Hello, I'm Dr. Teresa McGranahan. I'm one of the neuro-oncologists here at the Albert Brain Tumor Center. And today we're going to talk to you about cognitive changes in breast cancer. I want to start by introducing some of my panelists. Carl Christie.
Hi, my name is Carl Christie. I'm a nurse practitioner at the Albert Brain Tumor Center, and I'll be the mediator for today.
Hi, my name is Myron Goldberg. I'm a neuropsychologist at the University of Washington Medical Center, where I do evaluations of individuals' cognitive functioning.
And I want to start us off by a common question. Can cognitive changes occur in individuals with breast cancer? Dr. Goldberg?
Yes, individuals with breast cancer, most individuals report some form of cognitive changes over the course of their disease. It can vary in the type and severity of difficulties, but most people do.
And if that's the case, what kind of problems, Dr. McGranahan?
Well, thank you, Carl Christie. So oftentimes the first symptom that people report is saying that this feels like it's a memory problem. And a very common question I get is this dementia? Which it's not. But it's actually not even just memory problems. When patients undergo testing, which we often do with Dr. Goldberg, we can see that there's multiple domains that are involved. Dr. Goldberg, do you want to describe what this looks like?
Yeah, aside from memory, which as Dr. McGranahan said, there's a common difficulty. Individuals can have problems with attention, like focusing their attention, sustaining their attention on tasks. They can have difficulties with finding words to express themselves, at times. And then one of the common things that happen aside from memory also is processing speed. Things seem to slow down for individuals, that information is coming too fast for them and such, or problem solving becomes difficulty when they try to solve problems quickly.
So are these changes then due to chemotherapy?
In individuals with breast cancer have shown that chemotherapy can be associated with cognitive changes and such. And oftentimes we use the word chemo brain or chemo fog. That's probably simplifying the situation a great deal, as we'll talk about other causes of cognitive difficulties. And we like to use the term cancer-related cognitive impairment or cancer-related cognitive difficulties, and it may describe the difficulties that people are having in cognitive functioning, but also taking into account that there may be other causes of the cognitive difficulties other than chemotherapy.
I agree. There's also actually good studies that show that even in patients who have cancer who've never received any chemotherapy, there can be cognitive changes. We don't completely understand what this is, if it's an inflammatory effect of the cancer or some of the other treatments that patients go through, such as radiation and surgery. But cognitive changes are not just chemo brain.
And the other causes that we might think about in terms of difficulties with cognitive functioning are sleep disturbance, fatigue, pain itself, and oftentimes pain is associated with breast cancer, and pain itself can interfere with cognitive difficulties. An individual may be on medication for pain or other types of disorders, and that can also cause some of the cognitive issues that they're having. And of course, one of the things that we can overlook in terms of a cause is mood and anxiety issues that come up and that can give rise to cognitive difficulties.
And I'm glad you're mentioning all of these things. And so if the patient or an individual is experiencing these cognitive changes, what should they do? Dr. McGranahan?
Well, I think if you notice something changing in the way that you're thinking, the first most important thing is to talk to your medical team about it. We're here today talking about the changes that happen in the setting of breast cancer, but there are certainly other causes of cognitive changes, and there may be some tests that your doctors or your medical team need to order to help make sure that we understand what we're addressing for your cognitive symptoms.
And these tests, Dr. Goldberg, can you talk a little bit more about those things?
Yeah, if we're talking about evaluating cognitive changes and the difficulties that we talked about before, attention, memory, word finding, problem solving, or processing speed, we can assess those in a variety of ways. One of the first ways of assessing is your own assessment of yourself. That really starts everything rolling. in terms of, talking to your doctor about your difficulties, your own assessment of that. But your doctor, or a person in your medical team may also do what we call a brief screening of your cognitive abilities, or a brief evaluation of your cognitive abilities in their office. And this usually takes about 5 to 10 minutes. And this way they're trying to objectively measure your abilities in those areas that you may be having difficulties in. And oftentimes, if the difficulty is really significant, they can pick up on what type of difficulty you're having and the severity of that. The other way we go about doing evaluation of cognitive difficulties is through something we call a neuropsychological evaluation. And your medical provider may recommend such an evaluation be done when there needs to be more extensive evaluations of your cognitive abilities. What a neuropsychological evaluation does, what it allows us to do, is pick up on those difficulties better than maybe a small or a brief evaluation of those abilities and such. And then the evaluation, neuropsychological evaluations, helps in the idea of identifying, what type of cognitive problems you're having, the effect upon your daily functional status, as well as what causes there may be involved in your cognitive difficulties.
And would you be able to talk a little bit more in terms of treatment or prevention of cognitive changes?
Well, I'd like to take that away first. So, even when we're not talking just about breast cancer, there are some really important things that you can do to help to preserve or help to recover your cognitive function. The number one thing that can be done that has data in breast cancer, but actually for all of us as we age, is exercise. We don't completely understand what it is about exercise that helps with brain recovery, but it is a profound effect. You're going to have another segment that's available to you on this series to discuss exercise during breast cancer survivorship. Other things that are really important that you have other segments to view during this series is actually sleep. You heard Dr. Goldberg talking earlier about how poor sleep can contribute to cognitive decline. And so having good restorative sleep is really essential to healthy cognitive functioning. So I want to direct you also to the sleep segment during this survivorship series. And then another thing that's you have an option to view is nutrition. Where we all know that eating healthy foods is an important part of our general health during survivorship or not. And that's also true for your brain. I like to say the easiest way is that you should eat more things that come from nature as opposed to things that come from the factories. But I'll also direct you to the nutrition segment that's available in this series. All of these, even though you may be thinking about them in other capacities, are really important for your cognitive health. But outside of the things you may already be doing, Dr. Goldberg, are there some kind of strategies that patients might want to consider in regards to their cognitive function?
Yeah, there's a host of strategies that you can do to help with cognitive functioning. And we oftentimes call those strategies compensatory strategies. That is, you're trying to do changes in your environment or changes of how you approach tasks to improve your cognitive functioning. Such changes are using a daily planner to write down important information, write down your schedule, having that in a clear central place. We oftentimes use our smartphones a great deal to do the writing down or reminding us of important information or appointments with alarms on them. So that's one form of compensatory strategies. The other things that you can do is in your environment when you're doing a task to minimize distractions around you. Try to do one task at a time rather than trying to do multiple tasks. So if you're in the kitchen cooking, to try not to be interrupted, with phone calls and such. Or if it's at work, trying to keep your focus on the task and minimize the distractions around you and such. The other thing that an individual can do is kind of pace themselves through the day as well. So if energy is a distinct problem for you, to pace yourself through tasks, take rest when you can. Perhaps do the important tasks where you have the most energy. And many people may have their most energy in the morning, so you try to do the tasks early in the morning. So there's a host of things that you can do. There's sometimes your provider may send you to see a person who formally does treatment of cognitive functioning at a rehab center. And that individual is oftentimes a speech therapist. And nothing may be wrong with your speech, but those individuals get very much involved in what we call cognitive rehab. And they may show you some strategies, formal strategies to help you get through your day and to optimize your cognitive functioning as well.
So these are good strategies to prevent and treat them that individuals can do at home. What about medications? Would Dr. McGranahan, would you be able to discuss perhaps some medications?
Well, I wish I had a medication that could help to recover brain functioning or reverse cognitive impairment. Unfortunately, there's no medication that exists like that. Just like Dr. Goldberg was describing, the best way that we have to help with recovery for the brain is training or brain exercises. And so those sort of strategies that he described for compensation or sometimes cognitive therapy is the best way for us to heal our brain with reforming those pathways. That said, there are some medications that can help with things like attention or memory, but you really want to make sure you talk about this with your medical team. I wish I could say that there was a quick fix, but medication is not the way for cognitive improvement.
Another strategy too, because sometimes mood or anxiety can play a role in an individual's cognitive difficulties, is stress management strategies. And on your own, if you want, to get self-help books on relaxation, for example, join a meditation class or a yoga class. Make sure you're scheduling pleasurable activities in your daily life, or avail yourself of psychotherapy if you need to, and talk to your medical provider about how, possible medication strategies to help with mood or anxiety, because those helping with mood and anxiety can also improve cognitive functioning.
I'm so happy you brought those up because that's actually another area that has pretty good data to support it. So a specific type of meditation called mindfulness meditation is really designed to recognize when your mind wanders. All of our minds wander, and being able to pull it back in. That can really help us with addressing attentional difficulties. I like to think about attentional difficulties as none of us really, multitasking isn't really a thing. Even if we wear it as a badge of honor, we can really only do one thing at a time. And so helping to really direct our attention to that one thing.
Oh, these are wonderful, great points and such valuable information. And before we end, is there any last words that you both would like to say to our patients?
Well, one thing about cognitive difficulties in relationship to cancer and individuals who have breast cancer is that it's not necessary that the cognitive changes that occur, whether during chemotherapy or by way of other causes, are necessarily have to be permanent. In fact, most individuals improve in their cognitive functioning over time. There are some individuals where cognitive difficulties can linger, and hopefully over time, those two can evolve and not be as interfering in their daily life. So there's a great deal of hope. And in terms of when you do have cognitive difficulties during the time that you're after you get diagnosed with breast cancer and going through treatments, there's a good possibility that those cognitive difficulties can improve. And as we talked about here today, there are things that you can do to help your cognitive abilities in your daily life.
Dr. McGranahan?
Absolutely. I will echo all of that and say that nothing makes us happier than when people come back and are getting better with just a heavy dose of time. So all of these are strategies to try to help to accelerate that recovery, but there's a good reason for hope. This is not the same sort of thing as when we're talking about structural injuries to the brain, things like when we have thinking changes from dementia or other problems. There's reasons why this will get better. And survivorship doesn't have to be filled with cognitive changes.
Great. Again, thank you both for your time, and looking forward to continuing the series.